HSP Gold is a defined benefit plan which pays a specific amount based on treatment. It never pays more, never pays less, and it pays first. So what does that mean? Let's start by taking a look at the most basic benefit, the daily doctor's office benefit. All of our outpatient benefits have no copays, no coinsurance, and no deductible. The Level 2 plan pays $120 per doctor's visit, no more, no less. Each person on the policy gets 20 doctor's visits per calendar year. 6 of these visits can be a chiropractor, and all 20 of them can be a licensed professional counselor. The Level 2 plan also covers 2 specialist visits per year, up to $150 per visit. This doesn't mean that you can't see a specialist more than twice, but after the second time, the benefit only pays $120. Now, this is where it gets fun. Say you need to go to the doctor, and this costs $155. Your doctor is in-network, so this price is discounted $41.87. So the remaining cost is $113.13. Since the Level 2 plan pays $120 no matter what, after paying the provider, you receive the remaining balance of $6.87. If the doctor had been out of network, we will cover $120 of the cost and you would pay $35. This plan gives you the freedom to find the best deal, with the same benefit whether your doctor is in network or out of network. Again, the plan never pays more and never pays less. If the benefit is greater than the cost of the treatment, you get the difference in the form of a check. If the cost of the treatment is greater than the benefit, then you simply pay the difference. A quick note, this plan does not have a traditional pregnancy plan, so this may not be the best plan for you if you're planning on having a baby. Alright, so this covers your standard doctor's visits, but what about your annual exam? For that, you get a $250 annual exam benefit, which you can use on anything you want. For example, if you go in for an annual preventative exam costing $190, after a $66.57 in-network discount, we'll pay the doctor $123.43 and then pay you $126.57. Mammograms are a very important annual exam, so we have a $250 benefit specifically for that. As you get older, you're bound to have more preventative exams, which can lead to more out-of-pocket expenses. However, this is offset by the money you're saving here, the invisible bucket of money, which is the premium that you're saving every month. In fact, we save the average family around $6,000 a year. Over the next 20 years, a 45-year-old could easily save over $100,000 in premiums. Now, let's talk pharmaceuticals. Our pharmaceutical plan is pretty unique in that we reimburse you up to $20 for generic and $40 for name brand drugs. While other components can be network or reimbursement, prescription drugs are reimbursement only. Fill out a reimbursement form for each drug, attach it to the prescription receipt, send it through email, fax, or mail, and we'll send you a check for either $20 or $40 in a couple weeks. If you're taking a drug currently, like cholesterol or thyroid medicine, we also have a great discount plan through sites like GoodRx and Drexy.com. For things like x-rays, you have a benefit of $160. Again, with in-network discounts, you can find an option where the difference between the cost of the procedure and the benefit goes straight to your pocket. While it doesn't always happen this way, if you shop around, you get the reward. Not the hospital, not the doctor, not the insurance company. We also have Teladoc. These are virtual doctor's visits 24 hours a day, 7 days a week, 365 days a year, free of charge. This service is available in all 50 states and is great for minor illness like flu, colds, or respiratory infections, and minor injuries like rashes, bug bites, or stings. The Teladoc can prescribe basic medicines like amoxicillin, skin creams, and other topical medications, but not ongoing prescriptions like heart or cholesterol medication. But what if there's a more pressing emergency? If you have chest pains like an elephant standing on your chest or you're bleeding profusely, go to the emergency room. But if you can, call Teladoc, and they can recommend either an urgent care or send you to the emergency room. When it comes to these emergencies, we either pay for a one-time urgent care and a one-time for the ER, or we pay 2 times for urgent care without an ER visit. Most people choose to use urgent care once. If you need to use the urgent care a second time, you're allowed to use any of your 20 daily doctor's visits. So, if you needed to, you could visit the urgent care 21 times. This benefit pays $300 for the visit. So again, if your visit costs less than this, you get to keep the difference. Getting the pattern? For one visit a year, we pay $300 for the ER facility and $300 for the ER doctor. A couple things to note. Don't use the ER as a doctor's office, and always self-pay in the emergency room. Self-pay discounts in the emergency room can be as much as 90%, and in an emergency, the facility cannot forcibly collect any money from you. For instance, say you were bit by a snake and needed to visit the emergency room. The facility charge is $1,475. Because our plan is not major medical, it isn't considered insurance. Instead, we are legally classified as a supplement because we don't do everything that major medical does. We simply offer a package that covers relatively healthy people. This allows you to forego any insurance. Use the self-pay option, earn a discount, and bring your cost down to $177. And, of course, you get to keep the remainder of that $300 benefit. This plan also has a benefit for outpatient hospitals or surgical centers. For example, the middle plan pays $3,500 towards surgeries requiring general anesthesia, and $1,500 towards surgeries using only local anesthetic, like breast lump removal. Let's look at the most common surgery in the United States: gallbladder removal or laparoscopic cholecystectomy. The average cost for this in Dallas, Texas is $7,806. Our 2-unit plan will pay $5,742. So, with this surgery, you'd be out about $2,100. When you have need of surgeries like this, we'll help you shop around and find the best deal. The only time you have a deductible is when you're admitted to the hospital. For this example, we'll use a $5,000 deductible. When you have inpatient surgery, there's a $5,000 deductible, but there's an additional $2,000 hospital admission benefit for the first time you go to the hospital to help you offset this. There are plenty of other benefits as well. We have additional accident coverage that pays the first $4,000 of any accident anywhere. There's also a critical illness benefit that pays up to an additional $50,000 on top of the HSP Gold policy if you have a heart attack, cancer, or a stroke. So, say you need bypass surgery. In Dallas, Texas, the cost for a triple bypass is $42,609. If you stay in the hospital 7 nights, 4 in an ICU and 3 in a recovery room, under the 2 units benefit, your plan would pay $34,040 plus your $30,000 critical illness benefit for a total of $64,040. So the surgery would be totally covered with $20,000 to spare. Finally, there are 2 catastrophic umbrellas called specified disease and catastrophic accident in case you have cancer, a heart attack, a stroke, a bad car accident, or you're in a fire. Whew, that was a lot to cover. By signing with us, you don't just get a policy, you get agent support. If you have questions, need to have surgery, have any other needs, feel free to call your agent anytime, and they will be happy to assist you.